Hi there. I hope you all are doing well today. My name is Jake Martak. I am a student at CCBC in Essex, Maryland, and today I'm going to be sharing my experience speaking with a respiratory therapist. Now, sadly, I didn't get the chance to meet in person with a respiratory therapist. However, I did get the opportunity to talk in a Teams meeting with Professor Quinn from Northwestern University. Professor Quinn is the head of the respiratory care program at NYU. We spoke for roughly 30 minutes, and throughout this conversation, I asked her multiple questions regarding being a respiratory therapist, such as what does a day in the life consist of for a respiratory therapist? What was her favorite and least favorite parts about being a respiratory therapist? What are the education requirements to become a respiratory therapist? And what are some pieces of advice she would be willing to give somebody that is trying to become a respiratory therapist in the future? The first piece of advice that Professor Quinn gave me was the importance of time management. If used effectively, time management will be a very important part of your career. Respiratory therapists are expected to arrive 15 to 30 minutes early to work every single day because there is only a 14-minute window that you are able to clock in. If you clock in too early or if you clock in too late, it will result in you getting in trouble, otherwise known as getting a bing. Right after clocking in, the first thing you are supposed to do is head directly to your charge nurse. The charge nurse is the head nurse that directs all of the other nurses their assignments for the day. Once you go to your charge nurse, you will receive a chart with your patients and your patient's information on it. This information will include their name, their age, the reason for their visit, and any medical history. As you're going through your visits throughout the day, be sure to document every decision that you make with a patient, because if it is not documented, then there is no way to know for sure that whatever is going on with the patient actually happened. Two main diseases a respiratory therapist treats on a very common basis is asthma and COPD, otherwise known as cognitive obstructive pulmonary disease. Professor Quinn's least favorite part about working as a respiratory therapist is when a child's life or a young person's life is taken away and there is nothing that can be done. However, Professor Quinn's favorite part about working as a respiratory therapist is to watch somebody fully recover, to see somebody going back to living their full life once again. In order to get into the respiratory program, you need to have completed these prerequisite classes. That is Biology 109, which is studying human anatomy and physiology. You have Chemistry 107 and 108, which is studying fundamentals of chemistry and doing lab. English 101 and Respiratory Care 101. The general education electives consist of Fundamentals of Communication, Diversities in a Technological Society, Introduction to Psychology, and Math 125 or Math 135. The class program consists of one class in the spring, one class in the fall, then one class in the summer, then two classes in the fall, and then two classes in the spring. Finally, some pieces of advice that Professor Quinn gave me was to shadow in person as soon as possible, since sadly I was not able to. But because nothing can be compared to what you see in person rather than what you are told. Another piece of advice Professor Quinn expressed to me was the importance of time management again, and how it will lead to a very successful and effective career. Overall, this was my time, and I hope you all have a wonderful day, and thank you very much for listening.